Good afternoon, everyone. My name is Robin Kolbeck, and I'm the Senior Vice President of Business Development here at EPL. And joining me today, again, is Josh Hildreth, the President of Health Partners of America. And we both appreciate you being here today to talk to you about the healthcare arena. As we shared, health insurance is going through some unprecedented changes because of the Affordable Care Act. And we've developed a series of webinars to help you gain an understanding of the state of the insurance industry and its impact it's having on your employees, your members, your employer groups, and the neighbors of every community you serve. We're sharing a series of webinars with you every 2 weeks to keep you up to date on this ever-changing market. If you have been unable to see any of our webinars, you can gain access to those recorded sessions at the creditunion-exchange-blueprint.com. And there's several webinars that have been recorded for your viewing. Our session today, we're going to focus effectively dealing with the health insurance changes as an employer and how you can deal with these changes impacting your staff, their employer groups, and members. What we want to cover today are 4 options you face as an employer, share more what's happening on the public versus private exchange or marketplace options. We'll give you an update on the government progress and also the contrast between the difference between really a public exchange and then the credit exchange blueprint private market solution, and tell you how your credit union or your CUSO can fit into all of this. Today, our philosophy about people helping people, it expands as we near 2014 with the implementation of the Affordable Care Act. We feel you can provide your employees, your employer groups, and members access to the upcoming affordable health care options. So to talk more about this, Josh Hildreth is the President of Health Partners America. I'm going to turn it over to him.
Thanks, Robin. I appreciate you guys giving us some time this afternoon. Definitely some interesting times we're living in as we're seeing a change in what represents 1/6 of our economy and how the majority of Americans connect to financing their health care. All of the changes related to health insurance, of course, the launch of the exchanges, the state and federal run exchanges October 1st. So I want to talk today about employers. We do recognize that there are different solutions for different categories of employees. You may have a large group, 100+ employees, and you want to find a solution for the active employees or members or SEGs that are part of your credit union may have large groups and active employees. There's also small groups under 100 employees. They're active employees. You have a different situation potentially for retirees, for ineligible or part-time employees. Maybe you're working with chambers or associations, and of course just your independent consumers or members and how health reform is affecting them. So today as we go through this, I want to talk about what the options are going to look like in 2014. We're going to cover primarily 4 different ways that employers may want to continue to offer benefits or maybe not offer benefits. The first one is to continue doing what they've been doing and offer traditional group health insurance or perhaps a self-funded plan for some of the larger groups. Some of them may want to offer a group defined contribution model. Some of them, number 3 here, might want to not offer group coverage but offer defined contribution and allowance that can be used in the individual market. We're going to talk about what some of those advantages might be. And then some might want to drop group coverage, or perhaps they're not offering group coverage now and are not wanting to make a contribution perhaps because they can't afford to or they haven't been, and so it's not an expectation for their employees. Some options that they might have going into the future. So we're going to deep dive into each of these. Option number 1, stay on the tracks that you've been on. Keep offering traditional group health insurance or a self-funded. Some of the advantages, of course, are that for many it's the path that they know and they feel that change can be disruptive. The bad news is change is coming to all of us. The way that the health carriers, we're going to talk about some of the changes even to the traditional employer-sponsored group plans that may make you rethink staying on that same path. And of course, self-funding has more flexibility than employer-sponsored fully insured group plans in plan design, but of course it comes with more risk if the claims for that group are high. So before we dive into that, I want to ask the question, why are employers offering benefits now even though there's no mandate? So 85% of employers or 85% of Americans have insurance. There's no employer mandate and there's no individual mandate. The reason employers do it is to attract and retain good employees. Number two, there has historically been no other method for employees to get coverage on their own, especially if they have pre-existing conditions. The individual market has been underwritten and denied access to many Americans if they did have pre-existing conditions. And third is a moral obligation. And that really has to do with number two as well. If employers know that by not offering group health insurance, their employees are going to be at risk and not have coverage, and they know that by offering a group plan, they can have a group with as few as 2 employees and protect their employees from that risk. So many have decided to offer coverage because they feel that moral obligation to do so. So there are some changes coming to the employer market. The first one are mandates on plan design. So we're going to talk about what the new plans must look like starting in 2014. There's also going to be mandates on employer funding and participation. And there's new regulations and administrative burdens that will add to the cost and the angst of offering group health insurance. So let's talk a little bit about why group insurance premiums are going to be going up. The first reason is the cost-sharing limits are going to change, and we'll talk a little bit about that, what that means. The essential benefits that are going to be required, so the mandates that are in the individual and small group markets are going to be uniform, and they're going to follow these essential benefit requirements. Most group plans have traditionally had all of the essential benefits with a few exceptions, so there won't be a huge swing because of that. And then the way insurance companies rate for their risks is changing. They're all being forced into modified adjusted community rating. And we'll talk a little bit about what that means in practical terms. So first, cost sharing. There's 3 types of cost sharing limits that are going to be required. You've probably heard of this first one, the actuarial value requirements or metallic levels of insurance plans. So this is the same in the individual market as well, where you have the bronze, the gold, the silver, the platinum, and these are the actuarial values of those health plans. The out-of-pocket limits for group insurance is changing as well. So the combination of co-insurance, co-pays, and deductibles has pretty much been unlimited. If you went to the doctor, you paid a copay. It didn't matter how many times you went to the doctor. If you'd already met your deductible, if you'd already met your co-insurance max, the copays were usually excluded. But now there will be an out-of-pocket limit on all fully insured plans that includes copays, co-insurance, and deductibles. That once that limit is reached, the insurance company has to pay 100% of the claims. And number 3 is the deductible limit. So this hasn't been as popular for as long, but we started to see kind of a surge in the consumer-driven health plan designs with higher deductibles offset with gap insurance or spending accounts like HRAs, HSAs, and FSAs. So these are all different ways that employers or employees could fund pre-tax their out-of-pocket expenses before a higher deductible was met. So in many cases, employers had moved to a $5,000 deductible for family, maybe $2,500 for single, but paired that with a $1,000 HRA, where the first $1,000 was already on the house, and if you spent that money, then you had the cost sharing. And so those deductible limits are being changed as well. So we'll talk about each of those a little bit here. For the metallic plans, you have the platinum plan, which is 90% actuarial value, the gold plan, which is 80%, the silver, which is at 70%, and the bronze plan, which is at 60%. Now, this doesn't mean specifically that that's the co-insurance limit, that a platinum plan itself pays 90% of all the claims, and then the participant only pays 10%. What it is the carriers have to build their health plans that based on the average claims in an area, the plan design itself would be at 90% actuarial value. So it's not an actual direct deductible or co-insurance level, but it's a plan design. So typically a platinum plan design is going to have a lower deductible, lower co-insurance, and lower co-pays as opposed to any of the other plans, and the highest deductible, the highest out-of-pocket expenses would be the bronze plan. But remember, it's not a direct correlation to each person's plan that they only pay 60%. It's the plan design was built so that on average it would pay out 60% of those claims, and the participant would be responsible for the other 40%. The out-of-pocket limit rules that are changing that we mentioned earlier is that the plans are subject to the limit that currently applies to health savings accounts for qualified plans. And so we've gotten the numbers for 2014. It's going to be $6,350 for single coverage and $12,500 for family coverage. That means the coinsurance, the deductible, and the copays combined, once they reach these limits for single or for anybody more than single, it would be family, then the insurance companies must pay 100%. So if you think about it, their responsibility in the past has been mitigated by the fact that anytime they had a copay on something, that copay had to be paid every time a service was accessed. Well, now that's counting towards this out-of-pocket limit, which means you may get to a place earlier where the insurance company has to pay more in claims. So, of course, that's going to lead to additional costs. The deductible limits that are being applied in the small group market are $2,000 for single coverage and $4,000 for family coverage. This applies to the small group market. And what it means is that the maximum deductible is changing. Up to this point, like I mentioned, a very popular plan design is $2,500 for single, $5,000 for family. Those plan designs are no longer going to be allowed, and so the carriers are not going to offer them any longer in the small group market. Now, there is one exception to that, and that's really in the bronze metal tier, where a higher deductible can be permitted if a plan could not reasonably reach a given level of coverage without doing so. So if they have to increase that deductible to reach that level, then they are allowed to do this. You may see some slight variations, but most of the carriers and most of the plans will be maxed out at $2,000 for single, $4,000 for family. And so because of that, of course, the higher the deductible, it's just like your car insurance, your homeowner's insurance. The higher the deductible, the lower the risk for the insurance company and the less they can charge. So with the deductible limits being in place at $2,000 and $4,000, this, of course, will also contribute to higher rates in the small group insurance market. So if you're wondering, we are recording this session, and we'll make this recording available. If you're feverishly taking notes or want to refer back to this later, we will be making this recording available, so don't worry about that. So in addition to the cost sharing, we talked about the essential benefits. A lot of people are confused about what does essential benefits mean, and pretty much it's what the mandates are. And so it's mandated coverage. So if, for instance, you went to the grocery store to buy your groceries, and your grocery cart already had cereal, milk, eggs, some chicken, whatever the standards would be, already in the cart every time you went to the store. And so you were buying those things. They figure, hey, everybody needs these. Everybody's got to have them. We're going to go ahead and have them in the cart, and they've got to be purchased with anything else that's being purchased. So if you want to add additional, if the carriers want to add corn or tomatoes to the mix, then they can add those, but everybody's got to have the mandates. The mandates are pretty much the same that were in the group insurance marketplace before. Things like doctor's office visits, prescription drug coverage, hospitals, hospital stays, surgical schedules. The only thing that's really new that will add to the costs is pediatric dental and vision coverage is now an essential benefit and is mandated that is covered by all of the carriers as well. And so that's expected to add a couple percent to the monthly premium. So we've talked about the cost sharing. We talked a little bit about essential benefits. The other factor with traditional group insurance is going to be modified community rating. So in contrast with community rating, in which an insurer evaluates the risk factors of an entire market area, not those of any one individual person, when determining insurance premiums, modified community rating allows for premium variation based on individual risk factors with some limitations. So this concept helps maintain price fairness among high-risk individuals and the rest of the population as costs are spread across a group of people. So the biggest example of this, of course, is smokers. And in this new marketplace, smokers on average are going to pay as much as 50% more in their premiums than non-smokers. So if we add it all up, we've got an actual quote here from one of my carrier executive pals that asked to remain anonymous. He said if we add up these, the new cost and what the group insurance market is going to look like in 2014, if you add up the values, the 4% premium tax that's being applied to the carriers, 4 to 11% in the product increase, so including the essential benefits and the new cost-sharing requirements, 25% rating rule increase for the healthiest groups, and you add another 12% for the regular trend increase, you're looking at anywhere from 25 to 50% rate increase in the small group market. So it may not be that you can just keep doing things that, the same way you were doing before and not have to deal with some of the impacts of the Affordable Care Act. If you take a look at the bottom line, small group is getting more expensive because of the cost-sharing increases, because of the rating changes. The regulations are also burdensome. And this last one is a factor that most people don't talk about, and that's that the value to the employees is decreasing. And that's because the subsidies that are available to individuals whose employers do not offer coverage would not be accessed if the employer offers insurance. And if the employer offers insurance and it's optional to include your spouse and children, but they're only paying for the rate of single coverage, the spouse and children are also not eligible for the subsidies. So it's very important to understand just what the impact of offering traditional group insurance is going to be. We'll talk a little bit more about those subsidies and what that looks like when we get to the individual coverage options. So option 2 would be to offer a defined contribution plan with group insurance options. So this is a pretty similar path, a very parallel path to option 1 when it comes to the underlying plans. The difference is the employees will have more choice and a different way of shopping for those plans. So the basics are that the employers can specify the amount that they want to spend, and the employees use those dollars to buy the plan that they choose. The private exchanges will provide the platform for shopping, comparing, enrolling, and administering those plans. And employees are usually limited to a handful of plans from one carrier. The idea that a multi-carrier group option where all of the competitive carriers in a specific region are offering these plans that an employer can contribute to, and the employees can just come in and pick which carrier and which plan they want, is not a reality, especially for smaller groups. It's only been done with some of the very large groups, and it actually has not been as successful as those carriers would have hoped. So if we take a look at some of the headlines that have been out there, Forbes in late September had a headline that said Obamacare is killing traditional employer-sponsored health insurance. And one of the reasons is that groups like IBM, Time Warner, and now Walgreens are announcing their plans, moving retirees, IBM and Time Warner, and then current employees, which is what Walgreens did, in private health insurance exchanges with defined contributions from employers. So we're seeing with this with many large groups and many smaller groups as well, where they're wanting to really kind of get out of that annual dilemma where they're having to be the shopper and find the best plan for their employees, and they're setting a defined contribution amount that their employees can use tax-free in the group options that they make available, and then their employees are really becoming better consumers and having to do the shopping themselves and choose the plan that they would like. Now, this article went on to say that the overall insurance market will actually be much more oriented towards individual sales, and that people may stick with their same carrier for decades. And so that really leads us to option 3. And that's a definite change from how many employers view offering benefits now, and that's including the individual market. Up until this point, the individual market has not been an option for employers to leverage to offer benefits to their employees, mainly because of what I said earlier, that there was underwriting in the individual market, and not all of their employees would be eligible. And so some of the changes that have happened in the individual marketplace due to health reform are making it a much more likely place for your employees to want to purchase their insurance coverage. If we take a look at this article that was also, I believe, in Forbes, yes, earlier this summer, it talked about how health insurance would be turned on its head. And it said that the employer, even with a penalty in place, we know that that's been delayed for a year, but the penalty is a fraction of the value of the subsidy for a lower income family and a small fraction of the $12,000 plus that it costs the employer to provide family insurance. So the rational course for many employers will be to discontinue health benefits and instead offer employees a contribution to their health care costs. So the difference in option 2 and option 3 is that in option 3, the employer gets out of the insurance game completely and is no longer sponsoring any type of group insurance. They're discontinuing the way they've been offering benefits and making a contribution so that the employees could use their money towards health care costs. This article went on to say that much good would come of this because the awkward link between a job and access to health care is broken. Patients gain more control of a large part of their employment income, and they become consumers and start scrutinizing how their money is spent. One of the things that we found interesting since we've been implementing defined contribution with individual plans as options, even while health insurance has been medically underwritten, and the results of many of these larger employers moving to option 2, where a defined contribution is used with group insurance, is that when given a choice, employees are more likely to take those higher deductibles with lower premiums and save money, more so than an employer was likely to go with a higher deductible health plan. So it really does help them become consumers and start scrutinizing how that money is being spent. So what are these major changes in the individual market that are going to give it advantages over group insurance, and why will many employers move in this direction? Number one is the price. The premiums in the group major medical market are expected to be higher than the individual market. For everyone, this should say over the age of 50. And so I'm going to show you some examples of those premiums in just a second, and you'll see what the individual market looks like and exactly how affordable it can be. Number two is that even if those prices are higher than most people can afford, most Americans, based on their income, earning less than 400% of the federal poverty level, will be qualified for subsidies that will help them pay for their health insurance. And number three is the alternatives. Non-qualified plans like short-term medical, which looks just like major medical insurance, except that it is not guaranteed renewable, will offer more affordable ways to finance a family's health care. USA Today ran an article a few weeks ago on the new premiums that were going to be available in the state exchanges. And the quote that we pulled says that most of the markets will have at least 2 insurers to choose from, and 6 out of 10 people could pay less than $100 a month in premiums. And so if we take a look at what those markets look like, especially here in the Southeast, Alabama specifically has 7 different qualified health plans. The lowest cost for a 27-year-old before tax credits on the bronze plan would be $162. The lowest cost on silver is $200, and the lowest in the gold tier is $248. Now, because they're under 30, they could buy a catastrophic plan, which would only be $138, has a higher deductible. So what's interesting about this, you've probably seen, like I have, the conflicting news headlines or reports that premiums are lower than expected, but that premiums are spiking, and in some markets are up over 100%. So I want to explain the difference. If you take a look at these, this is the individual insurance market. And you could have gone on, a 27-year-old could go on right now to one of our exchanges and look for a plan with an effective date in 2013 and buy a similar plan design as this bronze plan for about $50 a month. And so this is definitely higher than what is available in the individual market right now, although that individual market would ask this 27-year-old a series of 15 to 20 questions before they decided to take them or not at that $50. But if you look at this price, the $162 or even the $248 on the gold tier versus the current group insurance marketplace, that on average is $450 a month for a 27-year-old, they are much lower. So prices have increased compared to the individual market, but as I mentioned earlier, compared to the group market, these plans are actually much more affordable, but it is based on age. And that affordability really starts breaking even and then getting more expensive in the individual market over the age of 50. Florida has over 102 plans to choose from, Georgia 50 plans. They're all fairly similar in price for each metallic level that's available. So this is a 27-year-old before tax credits. If this 27-year-old were to earn $25,000 a year, they would qualify for a tax credit to help pay for their health insurance. Now those tax credits are based on the second lowest silver plan in a market. That's the benchmark plan. And so the second lowest silver plan before the tax credit in Alabama is $209, Florida $218, Georgia $221. But that plan to be affordable for a 27-year-old making $25,000 a year can only cost $145. So that subsidy here is, what is that, $44. So you can apply that same subsidy to the bronze plan that was $62, and it'll help bring that cost down to $98. You can also apply it in the markets in Florida and Georgia and pay even lower for a bronze plan. But if you wanted that middle tier coverage, the silver plan, the most this individual would have to pay is $145 because of those tax credits. So if we look at a family and how this impacts a family of 4 with an income of $50,000, the second lowest silver plan before the tax credit is $757, $789, or $800 in these 3 states. Again, this is much lower than the average group health insurance premium in these states, which is around $1,200 a month. So already you could save several $100s by buying one of these plans. But based on the income of $50,000, the most that these folks can afford would be $282, and so the tax credit would pay the difference. And if they wanted to apply that tax credit to the bronze plan, they could do that, and a family of 4 could pay as little as $112 in Alabama and have coverage, $104 in Florida, or $132 in Georgia. All of these numbers come from the report that was released by Health and Human Services about what the premiums and plan availability was going to be in the various states. So as you can see, there's a lot of advantages in the individual market that don't exist in the group insurance market. Now, these are just the qualified health plans that are on the state exchanges. Those aren't the only options that are available. If you take a look at the insurance options and the rates that are available to individuals in 2014, you're going to have on-exchange qualified health plans. So those are some of the ones we were just looking at. Those are eligible for subsidies, but there may be some limited options, and they can be expensive, especially for folks that are older. The rates here, I pulled some rates here in Alabama, 27-year-old, $209, 54-year-old, $426. These are without subsidies. A couple in there that are both 28 would only pay $434. 2 58-year-olds would pay about $1,000 a month for their premiums. 2 30-year-olds with 2 kids would pay around $707, and 2 50-year-olds with 2 kids still on their plan would pay around $966. So some fairly affordable options as compared to group insurance, even without subsidies. Off exchange, there are qualified health plans by some of the major medical carriers, so there's more options available. Some of these plans are less expensive, although that's not a guarantee. You cannot apply subsidies to the off-exchange plans, but if you don't qualify for a subsidy, or if the subsidy amount is small, you may want to look at these off-exchange major medical plans. These are also guaranteed issue and don't bar any pre-existing conditions, and on average are expected to be between 20 and 30% less than the on-exchange qualified health plans, although that may not be true in every market. So those plans are about 20% less here. The third option that's available in a private exchange, which is the options that will be available through the exchange that the Credit Union Exchange Blueprint would bring. There's even more options to choose from here. There are no subsidies that can be used. They are less expensive, although they do offer limited terms or benefits. So there are limited benefit plans or short-term medical plans that are only guaranteed for up to 12 months and can be renewed. These do have a few medical questions, though. The short-term asks about 5 different medical questions. So they could exclude pre-existing conditions, but if you look, they can be much more affordable. A 27-year-old can get a plan for around $55, which is what it costs right now. A 54-year-old could get a plan for around $269. Two 28-year-olds could get a plan for as low as $125. The two 58-year-olds could pay around $730. The couple with 2 kids in their 30s would only pay $253 for their whole family to have coverage. So if you don't qualify for a subsidy and don't want to pay these higher rates for coverage, short-term medical may be the best option. And then two 50-year-olds with 2 kids would pay around $656. So these are just a snapshot of some of the options that are available in the health marketplaces off the state exchanges and available through private exchanges. Now, we mentioned the subsidies and the federal poverty limits. I do think it's important to note that most folks have a little bit of a misconception when it comes to health reform, that the subsidies are really only available for the very poor or the lower income. But 400% is actually a pretty high income level. In fact, many Americans will qualify for it. My family, I'm married, I have 3 children. We could earn as much as $110,000 and still qualify for a subsidy. Now, if we're in the 300 to 400% range, that subsidy may not be enough to make that plan as affordable as some of the off-exchange or the short-term medical plans, and that may be the direction that I would go if my employer was giving me a defined contribution and letting me choose. But I could finance my family's health care for much less than some of the rates that have been reported. National statistics do reflect that 63 to 68% of all households will have household income of 400% of federal poverty or less, but those percentages can vary by state and geographic region. So many Americans will qualify for those subsidies to help pay for individual coverage. So if we take a look at option 4, that's also leveraging the new options that are available in the individual market. We don't recommend this option to not offer anything. It's definitely a change in how many employers are viewing their ability to offer benefits. The employees would be on their own. They would seek coverage through government or private exchanges. But you would definitely lose out on an opportunity to take advantage of the individual marketplace, defined contribution methodology, or even providing them a resource like a branded private exchange or a private exchange by a trusted source like a credit union to allow their members to go. So for small groups who currently aren't offering any type of benefits and can't afford to, they at least know that their employees are going to be well taken care of through a private exchange promoted by your credit union. So let's talk a little bit about these exchanges and how they will play a role, especially for individual plans. The first thing to realize is that a private exchange is not just a website. And it's actually a way to not only connect to decision tools, insurance products, quotes, but ultimately websites don't sell insurance. Insurance professionals that are licensed and certified in every state are the ones who sell insurance. And so connecting to a local agent that you may have a relationship with, or the call center fulfillment options that are available through the Credit Union Exchange Blueprint will be able to provide live licensed experts to talk to each of those individuals, which will definitely provide a superior consumer experience than to that of the government exchanges. Now, one of the interesting turns of events that was made clear this summer is that the government had already foreseen that they were going to have some trouble with their state exchanges and their federal run exchanges, and that their perception of them, even if the websites were working, was pretty low. And so they did provide pathways for a private exchange to be able to facilitate that government subsidy that someone may be eligible for, even on a private exchange. So all of the options we talked about earlier, the on-exchange, the off-exchange, the non-qualified health plans, are not available in those state exchanges, but only in the private exchange. So everything the state exchange can have available, the private exchange has, but the private exchange has those additional options as well. So if we think about a state-run exchange, it's government-run. You think DMV, it's going to have limited products available. We've already seen the glitches, the long waits. It's not very consumer-friendly. The private exchanges run by insurance professionals can have exclusive products. We talked about some of the different products and options for health insurance to help make sure someone can find affordable coverage. Multiple insurance lines, so not just health insurance, but accident, critical illness, dental, vision, home and auto, life insurance, all of those options can be made available. Can also include wellness and other consumer tools and information. And our exchange platform even includes health reform information, calculators, videos, reports for both employers and for individuals. So let's talk a little bit about this launch on October 1st. Many people, when they logged on to healthcare.gov, found that they were getting the please wait signal. Some saw the system is down at this moment. We're 3 weeks later, and there are still significant issues, so much so that the president had to come out yesterday and do a press conference asking for the public to give more time for this thing to get fixed and to work. And he even used the words surge, a tech surge being needed to try and get things up and running. So it really isn't just about the website. They do have an 800 number, and the 800 number is experiencing almost just as many problems. There was one quote from one of the websites here. We've literally tried for the last 36 hours to enroll one person, and it is impossible. And so luckily, for the government, the private exchanges were built to complement, not compete with public exchanges. And so the ability for a private exchange to facilitate those subsidies. We do have some of the same challenges when tying into the Federal Data Hub to verify eligibility. It can time out. It can be slower. But you can always talk to somebody on the phone, and the experience is going to be much more pleasant. We can take information on paper and get it submitted if need be, if the technology is not working properly. So all in all, a private exchange that can facilitate individual health insurance can help meet an employer's needs, which are to attract and retain good employees, to offer flexible and affordable benefit plans that all of your employees will qualify for, and to maximize on tax savings without administrative headaches. It can also meet an employee or individual's needs by helping them make the most of their money, providing an easy and informative shopping experience, and live support by professional licensed consultants. So what does all of this mean for a credit union? We think that there's a unique opportunity that really is once in a lifetime. Your membership is made up of employers and consumers. Your prospective membership in your communities is made up of employers and consumers. Employers who want to offer benefits, consumers who want choice, but they want an easy shopping experience. And what better way to serve your members in your community than by connecting them through a credit union exchange to the insurance professionals, the third-party administration, and the health insurance carriers that will help them understand what their options are and connect them to the best options for them and their family. I work a lot with insurance professionals, and what I've found amazing is that while many employees do see their employers as a trustworthy source to help them grow and protect their money, they are second, and of course that is only to credit unions. So credit unions have done an amazing job over their history of providing value and education to their members and to their community, and so much so that they've received this coveted #1 trustworthy source label. And so for credit unions who want to be at the forefront of the opportunity that health reform is creating in the marketplace, we have created the Credit Union Exchange Blueprint. It's made up of 4 key components. The first is the online marketplace, which is your own private exchange that your members or your communities can shop for and buy insurance on their own. The quoting tools are available. There are multiple templates that to choose from and can be branded for your credit union or CUSO. The private exchange administrator area provides you with all of the tools and training materials, customizable sheets and presentations, and an easy step-by-step wizard to get your private exchange up and running as soon as possible. This is where we also have the recordings of calls like this, where we're educating the industry on what's going on because of health reform and its impact on employers and individuals. An industry-leading CRM or client relationship management system where you can view and track all of the leads that are being generated in the online marketplace. You can keep up with members who have purchased insurance, and it has very powerful reporting tools that can be used for membership drives for non-members who are visiting the site, for follow-up cross-sales to anyone who is visiting and shopping for insurance. And, of course, the call center. Our call center is staffed with insurance agents that are licensed in all 50 states and certified to facilitate those federal subsidies that were once thought to only be available on the government's exchanges. So that's an overview of the Credit Union Exchange Blueprint. If you want to see more, there are some recorded webinars where we go into a deeper dive on each of these 4 areas, and we'll have more of those webinars coming soon. So let's get started. This truly is an end-to-end solution from prospecting all the way through sales and servicing of the individual insurance products. It allows complete customization, site branding, lead direction, products, can even generate and communicate options for groups as well as the individuals. The win for a credit union or a CUSO is to increase membership, offer strategic growth products and services, and to strengthen member and community relationships. You can also activate new employee and employer benefits, become a national leader and prominent exchange expert, and a community hub, all because health insurance is changing for 145 million people. You can learn more about how the Credit Union Exchange Blueprint can benefit you and your credit union members at creditunionexchangeblueprint.com. As Robin mentioned earlier, this call will be recorded and made available there, as well as our past webinars. And our future webinar schedule is already online, and you can go on and register if you would like to participate in any of our future webinar events. So Robin, with that, I want to invite you back in and have you give any thoughts or perspectives that the credit unions or CUSOs who are on the line may want to hear.
Thanks, Josh. We appreciate everybody attending here today, and we hope you found the session beneficial to help you as employers, navigate the complexities of healthcare. As Josh said, you can see some of our prior webinars on the creditunionexchangeblueprint.com for additional information, whether that's on the Credit Exchange Blueprint product that's built exclusively for credit unions, or if you want to gain additional knowledge as it relates to the healthcare insurance industry and how to help you and your employees and your employer groups and members navigate the complexities of healthcare. We'll open it up. I don't know, Josh, if there's any questions that the group has. They can go ahead and submit those here now. Otherwise, you can find out some more information on the creditunionexchangeblueprint.com.
Yeah, Robin, nobody had typed in questions. Oh, there's a few more coming in now. All right, so Dan's asking, what is the first step for a credit union to take after watching this webinar if they want to take the next step towards getting this service started for their credit union? Robin?
You can go on, Dan, you can actually personally give me a call, or you can go on the site and the creditunionexchangeblueprint.com, and I'll be available. If you have your contact information, I'll be glad to reach out directly to you. But I am the person that you can work with directly to get yourself started.
That's a great question, Dan. I don't know if that one can be beat, Robin. What do you think?
I don't think so. Thanks, Dan. I look forward to it.
Those are the kind of questions we like, Dan.
Yeah, and Dan, my direct number is 205-408-5438. Again, it's 205-408-5438. Any other questions, Josh?
No, there aren't any other ones on there right now. I'm sure everyone's digesting. That was a lot of information we threw at you in the last 45 minutes. Hopefully it was helpful, and hopefully, now that we are closer to implementation, we are starting to see some 2014 rate increases come out from some of the carriers. It's hitting home. It's a little bit more of a reality for many of you, both as employers and as credit unions servicing your communities. So hopefully this helps you understand a little bit of the background of why the numbers are increasing, what the options are going to be, and how you can take advantage and seize this opportunity. It truly is a once-in-a-lifetime opportunity. We've never had a government come in and create the type of opportunities it's creating with the mandates, the subsidies, the incentives, and the confusion that it's causing in the marketplace, that for a credit union or a CUSO to have those answers, not just the big picture answers of hey, this is what Health Reform means and this is what's going on, but all the way through selling and servicing the individual options, facilitating those subsidies. It really is an exciting time. We are so excited to be working with EPL and bringing this credit union exchange blueprint to the credit unions that we're working with. So thank you all very much, and I appreciate you being on this call this afternoon.